Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Sorry to bother you, but I need to report an incident. I've had some liquid, maybe blood, splash into my eye. I've already flushed it with normal saline.
Did this just happen now?
A few minutes ago. I was taking the drapes off after the operation and some fluid just flicked up.
Was the drape heavily soiled in blood?
No, it was fairly clean actually.
Do you know the status of the patient? Any history of blood-borne viruses?
I'm not too sure. His notes are with him in recovery, but I can check.
You'll have to go straight downstairs to occupational health, where they'll advise and evaluate you and possibly take some blood. Then I'll help you fill in a formal risk assessment. Did anyone see the incident?
Yeah, Julie was helping me at the time.
Then we'll also need her to fill out some details.
Question 26. Now read the question.
Mr. Lee just threw a spoon at me.
A spoon? Why?
He hasn't stopped moaning about me all shift, so I told him to stop. That's when he threw the spoon.
Did it hit you?
No, he's harmless, but that's not the point. He just won't let up. He's fine with other staff, but everything I do seems to be wrong. Apparently, I wrapped his bandage too tight, and he even moaned that I didn't close the curtains properly.
Honestly, it does sound like he's singling you out a little. That's hardly fair.
No, it's not, is it?
I know. Let's ask if you can swap patients with me.
Really? I'd be glad to if you don't mind. I'm sure it's just me he's taken against. I don't want to go back into his room ever again.
I'll give him a few minutes, then I'll go in and try to talk to him.
Question 27. Now read the question.
So, as you all know, we had an incident today. Mr. Parks slipped and he's now undergoing further surgery, this time on his hip. So, having come in for a thyroidectomy, he'll be leaving here with a new hip, not to mention the added anxiety and stress to both him and his family. In the worst case scenario, this could even result in legal action. Now, all this could have been avoided if a minor spillage had been dealt with at once and protocol had been adhered to. I know it's been a very busy day and we're all under pressure, but incidents like this should never occur. I must emphasise, our policy of immediate action upon any spillage of any liquid or substance is in place for a very good reason, to protect our patients as well as ourselves.
Question 28. Now read the question.
I'd like to go over some possible side effects of your atorvastatin medication. This is all explained in the booklet I'll give you, but I want to make sure I answer any queries you may have before you're discharged. But remember, you should contact your doctor or the ward immediately if you have any concerns.
Okay, thank you.
The less serious side effects are commonly mild muscle pain or nausea, occasionally diarrhea. The more serious include severe muscle pain, confusion or memory loss, fever, fatigue, a change in weight, dark-coloured urine, or sometimes an increase or decrease in urination, increased or loss of appetite or thirst, jaundice and possible clay-coloured stools.
That's a lot to take in.
You won't need to remember them all, but it's important to be aware of any changes. Is there anything you'd like to ask?
No, I think I'm okay.
Question 29. Now read the question.
The next patient is Robbie Fisher in room 8.
I just met his mother as I was coming in.
Yeah, she's understandably very worried. OK, he's a 6-year-old boy, very unwell, admitted with hypoxia and respiratory distress secondary to a left lower lobe pneumonia. He was given a fluid bolus at 6 p.m. and was started on oxygen at 2.5 litres. He's on ceftriaxone. At around 12 a.m. you'll need to check that his vitals are stable and unchanged from now, and oxygen saturation hasn't dropped. Dr. Stone needs to determine if his blood culture is positive, and if his respiratory status worsens, he'll most likely get you to order a mobile chest x-ray to check for an effusion.
Sure.
Question 30. Now read the question.
So, how do you feel the consultation went?
It was okay, but I don't feel I connected with the patient very well. He didn't seem to want to open up and discuss his condition with me.
I'm glad you picked up on that. It's sometimes difficult for even the most experienced doctor to establish a bond with a patient from the outset.
How could I have handled it differently?
A key aspect of our profession is confidentiality between patient and doctor because it gives a foundation upon which they know they can rely. The patient needs to be assured of this, which in turn helps them relax. Asking questions that are then more open-ended builds on that foundation by allowing the patient to communicate in their own way. This shows that you're there to listen and provide support, and this is paramount for securing any doctor-patient relationship. It comes with a lot of practice.
That is the end of Part B.